In Guyana, accessing healthcare services for lesbian, gay, bisexual and transgender people is often quite challenging because of stigma and discrimination, which is relatively prevalent in the health sector. There's been great improvement made over the last few years, but there's still quite a lot of work to be done. Especially for transgender people, accessing sexual and reproductive health services is often met with lack of awareness about trans people and trans issues. I envision a Caribbean where every man, woman, transgender, non-binary person can be able to live freely, work, support their family, and not face any form of stigma or discrimination. In Guyana, there are definitely barriers to accessing the full human rights for lesbian, gay, bisexual, and transgender people. To begin with, the laws and policies are discriminatory and they criminalize intimacy between men. While the laws are not directly enforced, they provide a vehicle for state officials to use those laws for extortion. The harmful norms are definitely around rigid and toxic forms of masculine behavior. We need to educate boys and men that there are ways to express healthy masculinity, and we need to start them from a very young age because children grow up inculcating these very harmful attitudes and practices, and the cycle just continues. Public education is the only solution to changing harmful social norms and practices. We have to use all forms of media, mass media, social media. It's really the state's responsibility to educate the population about human rights. So ultimately, the government is responsible.